Another technique that's sometimes difficult, and again a therapist will shy away from it, and we only shy away from things that we think might fail. So we'll think, okay, I could use other NLP techniques here, maybe I don't need to use this particular one because the last client I used it with, it didn't work out well and I felt as if I had a bit of egg on my face, so I don't want to use it again, I'm afraid. And you might have even noticed that sometimes when we have a client maybe with an addiction like smoking or maybe an alcohol addiction, that, you know, if something doesn't work, it's really difficult because maybe that client notices as a failure and maybe turns it in on themselves and says, well, you know, this is what happens to me, I can't get better, nothing's ever going to work. So another technique is parts therapy, or you might have heard of it as a visual squash, but I've tended to call it parts therapy over my last 17 years in practice. And you know, it could be called conflict therapy because that's exactly what it's about. So a client will come in and they maybe even gesticulate saying, you know, on the one hand, you know, I feel as if I want to do this, and on the other hand, so they're actually telling you two parts of their mind are in conflict. And of course, if we break it down even more, we could say conscious versus unconscious. I mean, who doesn't know that smoking tends to damage our health? Maybe not for 100% of people, but we know all the dangers now. We'd have to land on another planet from, you know, somewhere else to not really realize how smoking can be dangerous for you. The same way with anything that we do in excess, any compulsions that we have. And so maybe even people say, you know, I lack confidence. I know it's stupid because I can do this and can do that. So they're actually telling you that there is a conflict inside their mind, that part of them would really like to be able to do this or stop some kind of behavior. And then there's another part of them that is preventing it. You could say that logically, so analytically, consciously, they know what they ought to be doing, but unconsciously, something prevents them, something stops them and gets in their way. There's some kind of barrier there, metaphorically speaking, that stops them from being successful. So again, it's not an easy technique because a lot of language is needed from the therapist to guide them and encourage them. And over the years, we've found it easier in NLP techniques to get the client to imagine that those parts are on either hand. And sometimes a therapist might think that whatever hand they choose with the behavior that they don't want, maybe that's the dominant side of them. Whether it's true or not, who knows? But it's what comes up into the client's mind immediately. Or certainly if a client gesticulates in some way, it's obvious what they're saying, which part of their mind. So the client's got their hands open like this, and if we can guide them to a particular part, say the part that wants them to be healthy and get fit, say, so they've said that's on my left hand, and if we can guide that client to look at their hand, they are going to trance out, and as they trance out, we're going to get lots more unconscious information. And again, a therapist will shy away because the client might be too analytical and say, well, yeah, I want to be fit and I want to be healthy, and I don't know really what the purpose is of that at all, but I just do. So it's not a lot of information that's coming back. And so we can ask again. So ask your unconscious mind, we might want to say, and without speaking too quickly, just take your time so it's less analytical and more unconscious. What's the purpose of that part wanting you to be fit and healthy? And so we'll probably get lots more information. I always think it's a good idea to get the client to thank those parts that are speaking to them and telling them about this conflict, so that part doesn't think that we're criticizing in any way, because the client can easily criticize themselves, saying, I know it's stupid if I don't do this, or stupid if I overeat, or whatever. So they're critical of themselves of it. So it's a good idea to get those parts to understand that there's no criticism that's going on. And then we'll ask the client to go to the second part. So the second part that wants them to carry on with the same kind of behavior. So it's leading them into smoking or overeating. And again, what's the purpose of that? Because in parts therapy, it's not so much the effect of smoking or overeating or drinking or any kind of compulsive behavior. It's the cause of what's causing them to do that. In smoking, often it's about relaxation or me time. With alcohol, it numbs my head. I don't have to think about anything. With eating, it's the same kind of thing. I just get a temporary relief from it. So there's the conflict. We've got one side wanting to be healthy and fit, and maybe they're talking about being in control as well of their lives. And we've got another part that's saying, no, when you feel down in the dumps or you can't cope with things, this is the kind of behavior that you're drawn towards. And the idea, obviously, of parts therapy is that we can get the part that is leading them towards the destructive behavior to find other ways of relaxing, being able to deal and cope with life, being able to deal with whatever comes along, and to agree that it's okay for that other part to keep them towards being healthy or in control. And although it might sound that it's not that difficult to do, it is difficult to do, because this particular part, say, the one that's led them towards that behaviour, it may have some difficulty giving that up, because the client's now got to think, okay, well, if I find relaxation just sitting listening to a relaxing CD or going for a walk or doing some deep breathing, that must mean I can't smoke anymore or have a drink or overeat. I'm not sure I want to give that up, because I like that behaviour and I know that it causes a lot of problems, but how do I come to terms with that? And the more that the therapist asks those questions, so what's the purpose of doing that, and what else could that part find for you to do that you could deal with things so much easier, and then at the same time either stop smoking, stop drinking, lose weight, whatever it is that they're in a conflict with. And as we talk them through it then and find that this part maybe wants exactly the same thing as the other part, because to be fit and healthy means we're in control, means that we can feel relaxed and happy, and maybe that part's always wanted that at the same time. It's just that been in conflict about the reasons how they do what they do. Of course, the next part for the therapist is to ask the client to close their eyes and imagine maybe they've got a magnetic field around their hands. And if those two parts are willing to work together, so what we're saying now is time to end conflict. And if that part is willing to end the conflict and the other part is willing to end it instead of fighting a battle all the time, then those two parts will start to move together. And one way that you can find out whether it's genuine is if the client just put their hands together straight away, it's more analytical, they've really just thought about it consciously. But if we get a very just small, slight movement, they're considering all the implications of ending that conflict and the behaviour that they need to move into. Sometimes it can take a long time, and again, a therapist might be quite concerned that although the hands are moving very slowly, but it's taking a long time to do it. Be prepared for that and be patient for that, for the client to really think it through and about what they need to do as well. Of course, students will often say, what happens if the hands don't actually meet? And again, it's for the therapist to make sure that it doesn't sound like a failure, but to say, well, it may not be now that those two parts are willing to end that conflict. Maybe tonight, maybe tomorrow, typical Ericksonian, maybe next week, maybe sometime that you will know that those two parts are working together, because the conflict will be ended and you'll be moving towards more acceptable behaviours for you. So there's no failure in that. It's just saying maybe it hasn't happened now, but we're going to give it some time for you to think it through. And so as a client may be still moving their hands towards, but it doesn't get anywhere, we can use those comments and then we can say, now put your hands down, and maybe move into nice future pacing with that client. If the hands meet together, then it's a nice idea to maybe bring those hands up onto their chest if you want to, or maybe just back down on the lap again so the client can take a nice deep breath in and feel satisfied and relieved that they can end that conflict. Because you probably know yourself that at some point in your life you've had some conflict about something or other. Shall I, shan't I, will I, won't I? And it doesn't feel good. We feel a bit out of control with it. So it's really nice if we can end that conflict and feel peaceful again.